This paper is called Conducting Intersectional Analysis in Nursing Research. I led this paper and had the great opportunity to co-write it with all of my graduate students. And it was a great team that brought together all of our diverse identities around language, around nationality and race and gender and sexuality and gender identity, to think about how we consider these factors in our research. So in terms of a bit of background in this, in conducting nursing research, it's always important that we ground ourselves in our theoretical perspective. So there's an expectation of any authors of nursing research that they declare their theoretical perspective, and that they speak to how they understand the world, and then they're couching their research within that lens. One of these common recent theoretical perspectives is called intersectionality. And so for us, what was interesting is that I was seeing a lot of people saying that that is their theoretical lens, but I wasn't necessarily seeing anyone writing about what that actually meant practically. So if you are espousing this intersectional understanding of the world, what does that actually mean for the methodology and methods of your research? Many of my own students were using intersectionality as the way that they saw the world. And so we came together to think about what that actually means and to look at the literature to see how people are writing about intersectionality and how they're using intersectionality. So to start, what is intersectionality? Well, first we need to think about social identities. And so social identities are things like age, class, gender, sexuality, race, any ways that humans essentially are able to categorize ourselves or each other. So what intersectionality says is that often we think about identities kind of one at a time, but really these overlap in very complex and in very interesting ways. And that we can actually do harm if we don't think about multiple identities at once. The often used example is the idea of white feminism, where gender is the priority concern. However, many Black feminists have expressed that the initiatives, the focuses of white feminism have actually hurt Black women. And so you need to think not just about gender, but you also need to think about race and class and national identity and all sorts of other aspects of who we are as people. So that's what intersectionality is. So you can see why, with health equity being a priority concern of nursing, many people would be drawn to this perspective to help them understand their worlds. And so in doing research, they might be looking at populations who don't have access to care, and these populations might have many interesting, important, and overlapping identities. So intersectionality is important, but what does that mean for how we actually do our research? In terms of methodology, there isn't a singular methodology that relates to intersectionality. Obviously, methodologies that are more attuned to social identities and particularly marginalities, things like community-based participatory research and other sort of qualitative, critical social ways of doing research fit more naturally. But intersectionality can be a lens brought to any work, qualitative, quantitative, critical, post-positive. It doesn't matter. It gives you a framing to think about your work. So any methodology fits. So when it comes to methods is where our team has a number of important recommendations of how intersectionality actually impacts the ways that we do our research. Our first recommendation in terms of actualizing intersectionality is to be as participatory or as collaborative as possible with the research participants. Of course, not all methodologies and not all methods lend themselves to full participation. However, collaboration means authentic consultation with those whom you are studying, as well as with those who are most impacted by the results. So participatory ways can be as sort of peripheral or simple as a community advisory group, or can be as complex as full participation. But it's making sure that you hear from your participants so that you can understand all the different ways that their identities are affecting the data that you are seeing. Our second recommendation is thinking about the intersections between one's own identities and those of the participants. And so this is known as reflexivity, and it's something that we should already be doing in most of our research. And so that means thinking about what locations you're coming from and bringing to the work, and how that might impact who you're talking to and what you're hearing from them. And so in doing interviews, perhaps, often myself as a white male professor, I'm not doing the data collection on the ground with participants if that's not appropriate. So our research with women experiencing homelessness, I often have other folks with lived experience of homelessness, people who are women identified who might be conducting the actual interviews with participants. But that's just one simple example because, as I said, intersectionality involves lots of complex identities. The third thing that we recommend is thinking about what information you collect from participants, and I'm thinking particularly about demographic information. So it can be challenging to appropriately ask identity information. However, if you're not asking that information, then it's going to challenge your ability to make conclusions. And so we've done a lot of work with communities who we are trying to sort of identify to understand the best way to ask. So for example, in terms of Indigenous identity, we work with our local experts at Western University as well as Indigenous people in the community to think about how we can ask about Indigenous identity in a way that is respectful, but also is going to ensure that we have that information so we don't miss making certain analyses about people's identities and what we're hearing. This is even more important in quantitative research, where you don't have the opportunity to sort of talk through these issues with people, to make sure you've got the right demographic questions so that you can think about how identities may be coming into play in your data. The fourth recommendation we make, very similar to participation, is finding ways to include participants in the data analysis. They can be as simple as member checking, where you bring your findings back to participants for their feedback. But ideally, it involves a more hands-on process where they're actually giving feedback throughout the process of analysis or helping out with the analysis as well. Our fifth recommendation is thinking about avoiding homogeneity of your research findings. This is particularly important for thematic analysis because in doing thematic analysis, the whole process is to sort of compress data down to a limited number of themes. But in compressing that data, there's a risk that we're often cutting out outliers. So in my own work, I've actually gotten away at times from thematic analysis because I've found that I wanted to hold many more differences than theming allows me to hold. So making sure that you're not having singular findings when the population that you're working with is complex and different. The sixth recommendation is back to reflexivity, but thinking about your findings and looking at your findings and being critical about the way that you're showing up in your findings. This is best done in the team analysis, where your team can all together think about, are we putting our own voice on this work? And if so, where and how have we added that? Not that that's wrong, as we know in interpretive and constructivist research, it's important to include ourselves in the work, but to make sure that we're not erasing or changing the participant's perspective to match our own perspective. And finally, our seventh recommendation is to take a look at your work to see who might be missing. So in terms of the diversity of people who participated, are there voices that are missing when you think about diverse and intersectional identities? Or are there pieces that you've cut out along the way through your analysis? So in conclusion, intersectionality is an important theoretical framing. However, to date, there's been very little written beyond how we understand the importance of intersectionality in terms of how we actually do research methods from an intersectional perspective. So hopefully our 7 recommendations can be helpful for you as you engage in research from an intersectional perspective. In the future, we hope to continue to expand and extend this analysis so that we can provide quality guidance built on our own learnings and our own experiences of doing this type of work.